Good morning, everyone, from Providence to Wilmington and from Lexington to Indianapolis. This is Free Atlantic Radio, the voice of the Northeastern nation. I am your host, Tom Kaczynski. I want to welcome you to our 26th episode. As you are listening, it is 9/9/2020. That is a Wednesday, although I am recording this at about 4:30 in the morning on Tuesday. Just don't sleep well. I don't know what it is. There's too many things going on in the world, don't you find? But that's why we have the show, to cover that, to keep you guys up to date and give you a different take on everything happening in the news that's helpful for people within the environment of our nation and beyond those borders. So I want to thank you for choosing the show, for your listening pleasure. Remind you that we only exist with your support, and you can send that to Venmo at CVCPRV, as well as send anything else to P.O. Box 35, Greenville Junction, Maine, 04442. And given that a whole bunch of people and a whole bunch of things are getting shut down these days, including the fact I've already had to migrate the podcast once, you might want to join the Telegram group, t.me/Atlantic Homeland. It's an opportunity for you to interact with other people, and mind you, it's an interesting and always ongoing conversation. I don't censor it because I like to let people talk, but if you act like adults, it works good. If you act like an idiot, you will get booted. It's the way it works in the world. It would work that way anywhere else because I actually think order is a little useful, especially when people behave themselves. However, I know that I am blessed to have an audience that is very aware and very awake, and so that's one of the things we talk about on this show so frequently. So we're going to take what we learned in the last episode about predictive programming, and to those of you who were out there looking for the information that was out there, a little bit of a DuckDuckGo search might help you find the information you wanted on Event 201, food chain reaction, as well as the Transition Integrity Project. And I kind of was trying to figure out what I wanted to talk about today. And sometimes it's really obvious for me what I want to talk about, but sometimes it's less obvious, and sometimes the mystery is the question. And today we're going to talk about something that's been at the heart of my mind and a lot of people's, and I think it will be one of the big things that shapes the future. We're going to talk about the vaccine for the COVID virus going around here. And what I want to tell you is a funny story about this where pieces are not adding up to me. And when pieces are not adding up, and I try to be a somewhat logical thinker, as you guys know, what it usually means to me is that part of the story is not understood. And so taking the lesson we learned from the last episode, and that from a life of being tricked over and over again that I think many of us have dealt with from our media propaganda complex, what we should do here is remember the trick by which you change opinions, which is, it's very simple. And I'll make it an algebra equation because it sounds much neater that way. For policy position C, the easiest way to get people of a certain group to support it is if Group A is opposed to Group B, and you want to get Group A to support the position, say that Group B does not like it, right? And that is something to consider with vaccines, because what we're going to look at is the strange and odd and evolving situation where with vaccines, the inherent nature of this is that for various reasons, Republicans in aggregate, although not exclusively, are more likely to oppose taking a vaccine. Reasons included but not limited to religious justifications, the idea of the involvement of the government, and general suspicion of that. However, you see President Trump, Republican, pushing like crazy despite multiple surveys that show that his base overwhelmingly compared to Democrats is skeptical of the vaccine, saying we're going to have Operation Warp Speed going, and now, as of yesterday, saw that they were reporting that he may have this ready as early as October, and that they're rushing to have this available on November 1st and to deploy it. Then you see yesterday Kamala Harris, and we'll talk about that, vice presidential candidate for the Democratic Party, saying that she would not trust the vaccine. And it has been my observation that if there is anything on this earth that gets fervent Trump supporters to do something, it is if Democrats don't like it. And then if you see the lever here, it's pretty obvious. If they hate it, we must like it. And then it becomes a question of where do you place your trust? Do you place it in Trump or do you place it in Harris? And what will happen is, and it's easy to predict, is a lot of people who would otherwise not want to take the vaccine probably will want to take the vaccine, because if she's against it and he's for it, it must be good. And what you see is, in this scenario, people have been manipulated out of considering the question on the merits of the actual vaccine, or on the utility of it, or on the larger situation. And it like so many other things in our society, has been subjected to the war of the inescapable dialectic that is the left-right conflict in the United States. It's ultimately going to destroy this country. But it's not just going to destroy this country because partisans on the left and right are going to fight each other. That's true, but that in and of itself is a symptom of a much larger problem that is, frankly, it's a dialectical problem going back to the nature of the Enlightenment that goes back to Hegel. And it's this whole idea that you, by going ahead and looking at a question, assume that if there are two sides, if one is wrong, the other must be right. And we keep making this mistake over and over and over again. And what has happened is our society has evolved in such a way where basically we are controlled by this idea that if you don't support this, you must support that, and you're presented these binary choices over and over again. And with the vaccine, what I would suggest is this is not a time for binary choices. I am, in the interest of full transparency, someone who is not going to take this. And I'm going to lay out a case why I believe that. But whether you choose to take it or not choose to take it, that is your business. That should be your voluntary choice based upon the facts of the situation, which is to say the severity of this disease, which we could talk about, and we will in future shows, although it's not going to be my primary emphasis point for today, and also what you think the safety is of the vaccine. But the whole point is that you are being conditioned to look past the question of the vaccine and look to the question of whose political benefit it accrues to. And this is kind of a trick. It's, I learned it more from theology than politics. But the leap of faith is about how you get past a problem, which is that there's a paradox where you can only... To get to a place, you have to go half the distance to get there, right? So if you're going to a town that's 100 miles from you and you're driving your car, you have to drive 50 miles first, then 25 miles, then 12.5 miles, 6.25. And what you notice is you never really get there. And this is the problem with building up support for a position. And this is why what politicians have learned, and it's kind of a unique little trick, but it works, is to say that, you know what, in order to accomplish X, you must do Y. And what happens is you never really reach X, but you always reach Y, and this is the trick of the game. That if you want someone to do something, you go ahead and you have them do it for another reason. I'll give you a perfect example of this. For many, many years, there were contentious fights about the idea of what was called ANWR, the Arctic National Wildlife Refuge, and the gas companies wanted to go in there, and they would never do it because people would fight on the issue, on the merits of it. So it'd be like, some people would say, well, we need the oil for security reasons, and some people would say, no, we need to protect the environment. But what happened was it became secondary to another bill, and it got included as a total non-issue because when people weren't thinking about it, they wouldn't disagree because they were busy fighting over something else. And ANWR just became the means to the end as a sweetener to pass a bill. So something that under other conditions, like for years I watched people fought to the death about whether or not this was a good or terrible idea, became a mere afterthought in light of a larger conflict. So when you are in charge of a government or in charge of any effort, or if you want to reshape the world, what do you end up doing? And this is one of the things I'm trying to teach you with predictive programming and whatnot, is that you set a goal off that is beyond your ability to reach as a means to accomplish policy. And this is why no one listens to wonks and everyone listens to visionaries, right? Because you're thinking, I want to get to utopia. I want to get to heaven. I want to get to the just society. And you'll rationalize anything. So when you look at the people in the streets, right, that are out there protesting and rioting right now, this for them is a means to an end. They want justice, therefore they will destroy things. Or if you look at people on the right, how they always support wars, they want security, so they will destroy things. On the nature nature of it, people would never go for such a stupid idea. But this is the power of the dialectic. This is the way by which society is shaped, and it's a very old thing. If you approach this from a theological perspective, you could actually read and understand that what this is this is what this was what the Garden of Eden was all about, right? It was the tree of knowledge, and it was good and evil, and my good is your evil, my evil is your good. And so that was one of the reasons why Christianity was such a radical religion and why the Romans didn't know what to do with it. Because ultimately, what it said was that in loving your enemy, you changed the equation. It no longer was about the question of who was right and who was wrong, although there, of course, was very much law involved with that, and I'm certainly not going to speak against sin. But it was an inversion of this traditional relationship where what you could do was you could put A against B on the nature that, well, I am right and you are wrong and you must suffer and die and be pushed aside. And that's what human history is. It's us fighting one another where we assume we are the forces of good. And when you hear people go out there and they make their moral arguments, they'll always say, well, I am good, I am right, I am justified, and this is what happens. But if you want to escape that, you need something radically different. And the radically different thing, and that's actually what the Atlantic values are about. Why do I mention the values I mentioned? Well, I mentioned reason and nature because reason tells you you're being manipulated. And nature tells you need to look at things as they are, not as who supports this, therefore who should I support? And it requires a bigger commitment from you as a person. You have to step up and say, hey, I'm going to look at the facts of the issue. I'm not going to support this because Democrats support this or because Republicans support it. And more importantly, I'm not going to oppose this because Democrats support it or Republicans support it or because Americans or whatever group you think. That you actually look at that and you see the nature of things as they actually are, and then have the grace enough to go ahead and say, okay, I'm going to look at this way and say, what would be good for people, right? And ask this is a sense where you're really bringing it down to the individual level, and what is goodness? Goodness is truth. What is truth? Truth is that which transcends each and every one of us, and that's what you should be seeking if you're going to be a better person. But the problem is politics has become a shortcut where we say we are going to jump forward over this, and in the same sort of way that the shortcut happens where you support policies because it helps your party, you support parties because it helps your vision of utopia and that you're trying to create a heaven on earth. And this humanism, if you want to call it that, has actually been the effort of since the Enlightenment, where we had this idea that intellect and discourse can get us to some better society. We've got a lot more stuff, but we've ultimately got a fractured and splintered society. And so we're going to have to bring some wisdom back into the mix, and that's where the loyalty to one another that's an Atlantic value comes in here. All right, so I'm giving you the big picture ideologically just because I want you to understand the way you have to think about questions as we ask this question of the vaccine, because the vaccine is interesting and weird to me. It's interesting and weird because we have people rushing to put this out there, and let's add in some extra facts so we know that we've covered on this show and that you can easily verify for yourself, that we know that even in countries where there has been a very mild outbreak, that increasingly aggressive authoritarian measures have been put into place in order to go ahead and make sure this vaccine will be distributed and administered, including checkpoints in Australia, interventions where governments that are nominally liberal in the sense that, they're in free societies, are going into people's homes and saying that if you try to organize any resistance, we will incarcerate you or we will quarantine you indefinitely. They're saying that until you take these sorts of measures that we're putting out there. And as you look at all of those things and you see a disproportionate response to the threat that's out there and against the laws that exist, to me, I see a leverage point happening where we see the rise of an authoritarian effort that is using the vaccine, using COVID, using the fears, which are legitimate, of a disease that's out there that whose scope we don't truly know. I mean, we could go into that. In fact, let's go into it. Let's do it that way. Okay, so just so we can put some numbers to this, because I want to go ahead and argue my case as eloquently as I can. This piece is by Matthew Brown, USA Today, September 1st, 2020. Fact check, CDC's data on COVID-19 deaths used incorrectly in misleading claims. And this is one of the great tricks of the media. You put a headline that doesn't fit the facts. All right, the claim, only 6% of the reported COVID-19 deaths were the result of the coronavirus. Quote, and I'm not going to read the whole story, but I just want to make the case so you have numbers here. A regular update of data on COVID-19 deaths by the Centers for Disease Control and Prevention has prompted a groundswell of claims that only a fraction of people have actually died directly from the novel coronavirus. The misleading and inaccurate conclusions come from recently released statistics on comorbidities data in the CDC's weekly coronavirus update with statistics as of August 26th. Quote, for 6% of deaths, COVID-19 was the only cause mentioned. For deaths with conditions or causes in addition to COVID-19, on average, there were 2.6 additional conditions or causes per death, the report reads. The data, which is maintained by the CDC National Center for Health Statistics, is an aggregated list of comorbidities on death certificates reported to the agency. And so, let's see. This week, the CDC quietly updated the COVID number to admit, this was a claim by President Trump, that only 6% of all the 153,504 deaths, and that's what would have been recorded as of August 26th, recordedly died from COVID. That's 9,210 deaths. The other 94% had 2 to 3 other serious illnesses, and the overwhelming majority were of very advanced age. And then the rest of the article, I'm not going to read it all, but basically goes into the usual partisan pissing contest about, no, this many people died and Trump is awful, or this few people died and Trump was great, where people's deaths are basically considered as a soccer ball to be kicked back and forth between them. But let's look at the evidence of the claim for a second, because this is interesting. That basically, one of the things we absolutely do not know about COVID, and it has been a struggle from the beginning, and to be fair, not all of this is malfeasance either, it's just difficult to know, is how many people died from COVID and how many people died with COVID, right? And so we have 150,000 deaths, okay, we'll use their number, 153,504 deaths of people who died with COVID. That's a number that we know, assuming the testing is accurate, and by the way, it's not. So, but we're going to use that number just as an operating principle. We know that as much as 20 to 30% of the tests or more have been wrong, and there's a lot of stuff out there suggesting the tests are searching for all sorts of coronaviruses. The FDA did not regulate these, so we have no common feature out there, other than that we know that there were tests that were rushed out there that claim something. But for the purposes of this scenario, let's assume the number is correct, even though we know it isn't, just to make it easier. So let's go ahead and split the difference. If we say that 6% of these cases were people who died from COVID, that was the only cause that could be attributed, and 94% were people who died with COVID, let's say that 4 times the amount, which I think is a reasonable number, are people who died from COVID, okay? So we're going to go ahead and just to do the math real fast here, because we like to do that, we're going to say, let's see, 6% ended up dying, 9,210. And we're going to multiply that number times 4. So let's say, and it's still a tragedy, by the way, let's not underestimate this, 37,000 people roughly died from COVID this year, which is a very sad number, and it's a serious illness that we should talk about, we should be concerned about, and that we have to consider, and that people are having problems. Yes, it is true, the overwhelming majority of these people were sick and older. Yes, a lot of people had comorbidities, and they were frail to begin with. And so we have to ask, is this worth fighting the way we've been fighting? And let's just look, I want to give you another number here, and I just grabbed this, I just Google searched it real fast. These are from CDC numbers. The annual estimate of flus, people who died from the flu in previous seasons, and flu season. Mind you, the flu season doesn't even run year-round. So in 2016, 2017, 38,000 people were estimated to have died. 2015 to 2016, 23,000. 2014 to 2015, 51,000. So let's put it this way. The amount of people who are dying from COVID at this point, assuming my estimate is somewhere near reasonable, and my estimate is literally, if you want to look at it this way, halfway between the point of saying everyone who had COVID died from COVID, and everyone who had things beyond COVID died from something else. I'm saying let's split the difference. And the way it works out statistically, the way I did that works out to about half, even though I didn't include half of the people, but you have people with very serious maladies, which is why you can't do it that way. That the number of people who die from COVID looks a lot like the number of people who die from the flu. And what we don't see in America, even though the flu has been around a very long time, with the exception of years like, 1918, where you had the Spanish flu, which was a very unique, distinctive strain, you don't see people being asked to commit certain actions. You didn't see the suspension of the Constitution. You didn't see travel restrictions, restrictions on worship, restrictions on small business, basically the shutting down of the economy. And let's expand this for a second, just for one moment. The same thing you're seeing is being done in other countries that have far more modest publicly reported numbers than we do, which suggests to me something bigger is afoot. And that's one of the things that a lot of people who are questioning this have said. Now, to be clear, it is my opinion that there were people at the beginning who questioned COVID that were saying that they didn't believe in it and therefore they assumed it was a hoax before anything happened, even though the evidence, and look, I spent more time researching the evidence than pretty much anyone on the internet, suggested quite the opposite. This was going to be an absolutely terrible pandemic. And in fact, the early evidence and data that came from China suggested to me strongly, and I'm on public record as having saying this, that this should have been a terrible epidemic where we would have seen somewhere upwards of 5 to 15% of the people die from it. Certainly that's what appeared to happen in Wuhan, although we don't know because, let's be honest, these are Chinese numbers, and China is not known for being honest about any of their numbers. Yet what did they do? They reported these terrible numbers from Wuhan. They shut down the city to the world where we didn't really get to see it. There was evidence presented out there that was circumstantial that no one really complained about that showed that this was a terrible death, and they allowed it to spread beyond their borders. But what if this was a psyop? Let's just pretend for a second that China wanted to shut down the whole world, and they had certain friends that would do it, and they made things look a lot worse in Wuhan than they really were. And is that the case? Maybe, because we never heard the outcry out of Wuhan you would have expected. And mind you, people are afraid of an authoritarian system where people get sent to organ harvesting plants, as happens to the Uyghurs in China and people who violate their system. But maybe the case was that this was an effort to promote something where people were afraid and they acted and they overreacted and they gave power away, like President Trump did in March. Now, the question is, you say, oh, well, why would people do that? And then here's the terrible thought. What if they were in on it? Now, let's talk about President Trump for a second. I'm going to piss off my Republican friends because I often piss off my Democrat friends on the show. And remember, I am telling you this as an Atlantic person. My homage is to our new nation that's bounded on sane principles so we don't have to have the poison of partisanship that Washington so derided. That President Trump is always presented as this external figure that is the ultimate against the system guy. But remember, this was a guy who literally came up in the shady deep state world of casino financing. And if you don't know what casinos are to the deep state, they're money laundering operations. That was put as the face of America on TV for decades. First in various shows, then on The Apprentice show on the very same NBC network that so attacks him. So this idea that Trump is the ultimate outsider, I mean, if you really want to get into it, the guy who brought Trump up, his name was Roy Cohn, and he literally was a fixer who played the role in taking down Joe McCarthy, the same Joe McCarthy that was fighting communism in this country. So if you go back in time and then you consider some of the policies he's pushed, what has Trump actually pushed through? Prison reform to let people out who committed crimes. I mean, these actions that we've had are not consonant with a far-right fascist. In fact, Trump is a moderate 1980s Democrat at worst. That's literally what we have in the presidency. And, you know, that's the person. But we have a narrative that has presented this virtue and value of saying that he is this hardcore right-wing guy. And it's not. I know hardcore right-wing guys. They're nothing like Donald Trump. But I present this case to you because when we look at Trump, we assume, and I think most of us assume, to be honest with you, and I did for a very long time, that, you know, people can change, and he was someone who was really against the system and against the state. But let's put it to you differently. What if, in fact, he is the perfect example of controlled opposition? What if he is the one who's going out there pushing forth Operation Warp Speed and making sure this vaccine gets out there because the deep state understands a lot about the way the people are. It understands that people on the right do not trust government and will not go ahead and listen to government unless they think the government is their government. And for nationalists, the only thing they hate more than government is communists. And what they see is communists in the street, Trump standing against them or being besieged by them and saying that we need to have this vaccine so we can open up and we can go back to our society, right? And if you think that way, well, what does it mean? Well, I want to beat the commies, so I'm going to go out there and I'm going to take this vaccine. Yet you wouldn't take that vaccine under any other circumstance, but your ability to reason gets short-circuited because this side bad, my side good, listen to my side. And it works with the vaccine uniquely because the people on the left, who on the other hand probably wouldn't take a vaccine, might think of it differently, are also going to be like, well, I want to be safe. I want to follow authority. And people on the left, I will tell you this, people on the left are usually more concerned about safety. People on the right are more concerned with liberty. So you've basically engineered a situation where the people on the left will take it for safety. The people on the right will take it for political reasons. And so everyone's being pushed into this vaccine that will be mandatory, from what I can tell, and that we are being promised is absolutely necessary, not just for our society, but we literally see spy agencies between different groups fighting to put these forward in the different countries, all right? That for something that, based on the numbers, is no worse than the flu. And they've been conditioning us for that, for flu shots, right? And if those of you who study flu shots will know this, is what they do is they take strains from the previous year, and they'll give it to you, or they'll try to assume what the strain will be, and you'll take it, and then you'll get sick from that, and usually you'll get sick from the flu as well. Why? Because it's the wrong strain. And that when you take the wrong strain, you start having all sorts of problems. And we'll talk in the end about the hazards of actually getting a vaccine wrong. But first, let's talk about what this vaccine is. The Rsv Vaccine, which seems to be the one that's being pushed fastest, this is not a vaccine that we people used to take. This is not the old, put some serum in there, let your body build antibodies, hope for the best. This is different. This is RNA modification. This is going into your body and changing the nature of who and what you are. This is you hacking your system to become a different sort of being so that you can fight COVID. But what is COVID? And we still don't know. I mean, I got a brilliant article sent to me by, what a supercomputer analyzed it to be, and it was complicated, and it talked about how it was hacking our system in ways where it was learning to survive. It's almost like it was a super intelligent virus designed to get certain outcomes. And as I keep looking at how every step of this is man-made, and every step of this is deception, all I know is that I don't know to trust any of the information I'm reading, other than I can see that there is a motive that is happening at every level of this thing to say, you must take this, you must support this, you must do this. And when everyone else says yes, and I see everyone jumping off that bridge, it is my nature to say, wait a minute, no, something doesn't pass the smell test. And this week, having a fight where Trump is pushing like crazy to have a vaccine put through, and you see Kamala Harris saying, well, you can't support this, Trump supports it. We have such an inversion that is being a publicly scripted feud that I'm wondering, why are we being pushed so hard to take something for something where the numbers don't justify what we're doing? Economically, they do, but our economic response is totally disproportional. And in the same way, we see that economic response is being worsened because neither party will support the people by providing the support financially for them to go forward. We are being rushed into action at a time where it doesn't make sense, and it's totally, entirely almost, an artificial creation. So let's talk about what this is, and let's go to USA Today again. I'm going to grab a different story. This is from September 6th, 2020 by Elizabeth Weiss. Mind-bogglingly complex. Here's what we know about how COVID vaccine will be distributed when it's approved. And I want to talk about the distribution because the fact they're rushing to go in so deeply with this, to me, is troubling. And there's just pieces I want to pull out of this. And then we're going to talk about the conflict. And then we're going to talk about the history of rushed vaccines so that you can make an intelligent decision. Now, as I've said, I am someone who does not support this based on the facts of it, that we are being rushed into something that is suspect in so many different ways. Okay. We don't know when a COVID vaccine will arrive, but we're starting to know how it will be distributed. And I will say, by the way, what started as something saying we were going to have this available in January, that there's been this build of artificial momentum, that now they're saying they may have it out as early as October. That's the latest from the Trump administration. And we're running out of time for this to not be forced forward. So this is something people need to be aware of. We don't know when a COVID vaccine will arrive, but we're starting to know how it will be distributed. Interviews with logistics experts, immunization professionals, and pharmaceutical distribution specialists, together with the U.S. Centers for Disease Control and Prevention planning documents, give a clearer picture of how coronavirus vaccines will get from manufacturers into the arms of millions of Americans. The swift and so far positive effort to create vaccines for COVID has been remarkable, but it's only half the work, said Tin Long Dai, professor of operations management who studies healthcare analytics at the Johns Hopkins University. Keep in mind, that's that same Johns Hopkins University that was doing the Event 201 planning. Funny how they keep popping up. It's just incredible. I think the vaccine supply chain is one of the most mind-bogglingly complex supply chains ever built, he said. The process will be run by the CDC, which for decades has overseen vaccine distribution in the U.S. and ran the last national vaccination effort during the 2009 H1N1 influenza pandemic. So let's keep in mind, this was the CDC that said first you have to wear masks and not wear masks. Then it was saying that, this is not a bad disease at all. This is a terrible disease. Now we are seeing them being pushed to the front yet again. And look, people make mistakes, that's fair. But the CDC has basically been a source of disinformation through this whole campaign, back and forth. We're happy to see the CDC front and center, said Dr. Kelly Moore, Associate Director of Immunization and Education with Immunization Action Coalition. They're the right organization to be leading this. All the vaccines supplied in the initial phases will be purchased by the U.S. government, and no one will be charged for the actual dose. This is interesting to me, too, also. Have you ever known the U.S. healthcare system to not charge you for anything? I mean, let's be real blunt. Let's be sickeningly honest with one another for just one moment. This country loves to make money off healthcare. You watch any news station, you watch Fox News, MSNBC, what do you see? Ad after ad after ad for a healthcare thing. Take this pill, take that pill, take this injection. So the fact that we're suddenly being altruistic in and of itself is questionable because there's so much money in it. Now, mind you, you, the government, the taxpayer, would theoretically end up paying for this through the government, but it's curious that there's such a rush. Just want to keep that in mind. Because someone wants to bill it, right? As of early September, it wasn't clear whether clinics would be allowed to charge an administration fee for getting those getting their shots. If one was charged, it's not clear whether insurance could be reimbursed for it if the vaccine is issued under an emergency use authorization, CDC documents say. At least at the beginning, the vaccine is expected to be in short supply, though CDC planning documents say significantly more will be available by January 2021. The CDC is still finalizing who will be eligible to be vaccinated first, but from the meetings of its Advisory Committee on Immunization Practices, it appears frontline medical workers, first responders, and people at high risk for severe disease will get first dibs. Dozens of experimental, remember that word, COVID vaccines are being developed in the U.S. and beyond, 7 of which have been funded at least in part by the federal government. All but one require 2 doses given 21 or 28 days apart. And that's weird. You don't really see that. Why is that the case? People getting vaccinated will get a COVID-19 vaccination record card that will tell them which vaccine they got, when they got it, and when they should get their next shot, CDC planning documents go. So this is your health passport, by the way, in case you want to know this, because the courts have already ruled, and you see different states putting out requirements, not only like Virginia, that you will be mandated to get this, but in fact that you can be denied access from work, from travel, from shopping. So if you are someone who has a question about this, you better be ready to exist outside the system. And does that sound extreme to you? It's no more extreme than when the government's own policy planning is saying, both at the federal and state levels, right? 2 of the 7 vaccine candidates are seen as the frontrunners because they are in phase 3 clinical trials, the make-or-break large-scale tests in humans that determine whether a vaccine works. They are being manufactured by Pfizer and Moderna. The 2 vaccines must be stored at different temperatures and so will be distributed slightly differently. A third from AstraZeneca in the United Kingdom is also in phase 3 trials, but doesn't appear to be part of the CDC's initial planning scenario. An initial vaccination plan. Here's how it will work. Medical offices, clinics, hospitals, pharmacies, and other groups that want to vaccinate people for COVID need to first enroll in the U.S. COVID-19 vaccination program. They'll sign an agreement with the CDC and prove they have the space, necessary equipment, and properly trained staff to administer the shots. Because the requirements for storing, handling, and administering the shots are so challenging, the government will prioritize getting vaccines to sites that can reach large numbers of priority populations and vaccinate lots of people quickly, CDC documents show. When a vaccine becomes available, a vaccination site will request doses through a state agency, usually the Department of Public Health. That's how it was generally done during the 2009 H1N1 influenza pandemic, said Julie Swan, professor of industrial and systems engineering at North Carolina State University, who was a science advisor to the CDC at that time. So the states are going to administer this. This is what they're telling you. Okay, the Department of Health would confirm the site was okay to distribute the vaccine. At that point, if vaccine supplies are limited, the state could determine how much vaccine to allocate to that specific site, perhaps less than was requested. Next, the order will be electronically transmitted to the CDC. The CDC also could decide how many doses to allocate to a given site if vaccine supplies are limited. The CDC will then transmit the order to its contracted partner, McKesson, the largest pharmaceutical distribution and technology company in the United States. It already has distribution centers across the country and is building more for COVID. Vaccine orders will be shipped within 24 hours of approval, depending on supply, the CDC planning documents say. National pharmaceutical chains such as Walgreens and CVS could partner directly with the CDC, with military allocations going through the Department of Defense. Along with the vaccine, a separate supply kit is to be sent that includes needles, syringes, alcohol prep pads, and a small supply of personal protective equipment, including surgical masks and face shields for the staff giving the vaccine. Okay, so this is just explaining how it works, but I want you to see how quickly they're putting it into basis. You have the private and public sector working very fast on this, and that this is going to go forward. And keep in mind that once you have this, we're going to have these certificates you're going to be required to have, and this happens with schools already. This happens where you can't send your kid to school. In fact, Maine, sadly, is the first state in America where you can't have either a medical or religious exemption. And this has been an incredible fight up here that's leading to a lot of anger. But this is something that's happening. The idea that you are losing control of your body, where you are losing your sovereign citizenship, and that the government can poke and prod you as much as it wants because you have no right in light of a public emergency. But have you ever noticed that if a government wants to take away your rights, you're given a public emergency? And so I would ask you, do you think COVID should be forced on people? And a lot of people, you see these things starting to be pushed out there, and there's a perfect example of a push poll in Australia where they put out this public poll that said most people in Australia do in fact support taking away rights from people if that's what's needed to shut down COVID. Why? Not because of COVID, but because of the suffering that's been put on our economy, to tell you the truth of it. And do you trust the actual results of a poll that was reported in the media? Remember the election results if you want any example of how a poll doesn't match with what's seen. Something to consider in your mind, because remember, you're believing information that's being sent to you every step of the way, and how much trust you have in people whose job it is to lie for you, or lie to you, rather. All right, the devil is in the details. Here's where things diverge a bit. Moderna's candidate vaccine has to be stored at minus 4 degrees Fahrenheit, but Pfizer's requires it to be stored at minus 94. If either of them are among the first vaccines available, that 90-degree difference means they must be distributed differently. The Moderna vaccine will be stored at either the manufacturing plant or at a McKesson distribution center. When an order comes in, McKesson will ship it directly to the medical facility that ordered it, said Moore. The Moderna vaccine comes in a frozen liquid in a 10-dose vial and contains no preservatives. It can be stored in a freezer or in its shipping container if it's replenished with dry ice, CDC documents show. It can be stored for up to 2 weeks at normal refrigerator temperatures, 36 to 46 degrees, according to data provided by the Immunization Action Coalition. Once at room temperature, it must be used within 6 hours. After the vial has been punctured to take out the first dose, it is good for 6 hours and then it must be thrown away. Because vaccine will be in short supply, especially at first, clinical sites will need to schedule patients so none is wasted. To be effective, the Moderna vaccine requires 2 doses given 28 days apart. It must be the same vaccine both times. The Pfizer vaccine is more finicky because of its ultra-low temperature storage requirements, though that may change as more tests are done. Because of the current requirements, CDC will send orders straight to Pfizer, which will ship to the vaccination sites, Moore said. The Pfizer vaccine will be shipped in a special transportation container filled with dry ice. The box can then be topped off with dry ice every 5 days to keep it at the appropriate temperature. The vaccine comes in 5-dose vials without preservatives, according to a presentation this company gave to the CDC last week. So it sounds like the Moderna one's going to get pushed more because it's a lot easier to do, right? The individual vaccine vials can be refrigerated for up to 48 hours, but be held at room temperature for only 6 hours. States are currently surveying their systems to know where their sub-80 freezers are. Swan said, I would expect that type of cold storage to be available at large hospitals, scientific research facilities, and some large pharmacies. Each of Pfizer's specially contained transportation containers, which are about the size of a thick pizza box, contain 195 vials equal to 975 doses. One container can hold 5 of those boxes, or as many as 4,875 doses. Because it's being shipped only in large volumes, the Pfizer vaccine likely would be distributed to larger medical centers or public health departments that have the capacity to vaccinate large numbers of people and the proper storage facilities on site, Moore said. I'm sort of curious. I don't know the answer to this, but it'd be interesting to look at. If someone finds anything, I'll give you credit for it, why these are so divergent, and if that's normal to have something require that level of coldness. It's almost like, I don't know if that's weird or not, but it's weird that these things are so different. Before use, Pfizer's vaccine will have to be mixed with a special liquid to dilute it, probably something like still water. The liquid would be shipped separately. Once it's mixed, it must be used within 6 hours or discarded according to the Immunization Action Coalition. It requires 2 doses given 21 days apart. Among the other vaccines closest to applying for authorization with the FDA, some require refrigeration, and at least one can be stored at room temperature. If more than one vaccine is authorized, distribution will depend on how well each works for different populations, says Prashant Yadav, medical supply chain expert and senior fellow at the Center for Global Development, a think tank in Washington, D.C. Whatever the timing of an FDA vaccine approval, the complexity of storage, delivery, and tracking multiple vaccines with different requirements means states have to be setting up systems today, Morris said. Planning now allows us to identify the glitches in our process now, so we can't wait until a vaccine's approved. So we can't wait until this thing's been tested. We can't wait till this thing's been proven. We can't wait till long-term results are considered. We can't wait to consider any of this. We just have to start pricking and prodding people right now. This is how your government looks at you. Cows in a herd to get shot up. Don't do it. Do not do it. And I'll just say, and even if you believe in safety, look, you can be the biggest, most rampant pro-vax or anti-vax person. You deserve to know if something's safe. How many times in history do we see examples of goods being used that we're told at the time are absolutely great? Like asbestos was once considered a wonder insulator, you know. People look at, what was the thing? DDT, you know, which increased crop yields, but oh wait, it led to cancer years later. And we don't know with this vaccine. These are untested technologies that, at least in the case of the Moderna vaccine, which I've studied a bit, is actually going to change the way that your body works. And who knows what's intended. And keep this. This is all assuming, and this is a really big assumption, this is all above board. I don't make that assumption. I don't assume that the government works in our best interest ever, and I don't assume just because the government's giving us something, they're giving us what they say. There are so many historic examples, especially within the vaccine community, of them using fillers that have caused many people to get sick, and then you can't sue them to find out and get discovery because they're given blanket immunity from the government, the same government that gets so much money from the pharmaceutical companies. And so as that comes forward here, we see an interesting situation where, you know, you would never expect me to be the guy saying this given my background, but I'll read the story in The Guardian from today, or by Saturday 5th, from Lauren Aratani. Kamala Harris says she wouldn't trust Trump on the safety of COVID vaccine before election. She's got a point. She's absolutely got a point, and the fact that I think that some of her views are abhorrent doesn't mean that I shouldn't consider the logic of the argument. And this is one thing I demand from my audience. We're going to consider arguments being made on the sake of the argument. So let's see what her argument is. Kamala Harris said she would not trust Donald Trump's word on the safety of any coronavirus vaccine approved for use in America before the November election. In an interview with CNN, excerpts of which were released on Saturday, the Democratic vice presidential nominee warned of the potential for political interference by the U.S. president over the approval of coronavirus vaccine in order to boost his re-election chances, right? So let's talk about this for 1 second. She's saying that he's rushing this because he thinks it'll get more people to vote for him. And that may be true. But it's also true that making this a political issue makes people act differently with the virus. She's against this. I want to take it. And what's the big problem for the state? The state wants as many people to take this as it can. It also knows, statistically speaking, the people least likely to take it are right-wing Republicans. So what happens? You are creating the perfect storm to get right-wing Republicans to go, I'll take this first. I'm with my president. Be careful. Be careful. Asked if she would personally take any vaccine given the green light in the U.S. before the November poll, Harris replied, I will say that I would not trust Donald Trump, and it would have to be a credible source of information that talks about the efficacy and reliability of whatever he's talking about. I will not take his word for it. So what will happen, and I'll just put you how this actually plays out because it's easy to put the future. The left is going to look what people in the CDC say, people like Fauci. They're going to look at that, and if he says it's okay, they're going to take it because they follow authority figures. And the right will go ahead and say, well, I'm going to take this because Trump says so. So what happens? Everyone takes this vaccine that's being rushed at warp speed. And what's warping mean? Warp speed. Warp literally means to change the nature of something in order to go ahead and due to other pressures that are out there. So one of the things that's really funny you learn about predictive programming is they usually name things in ways where it's really obvious where things are happening. So warp speed, to warp who we are at impressive speed. That's what it could mean. You're like, oh, it doesn't mean that. You're too cynical. Look, I'm not cynical enough. You've seen the last few years. How many times do you have to be fooled before you won't be fooled again, you know? Go watch I Pet Goat. And see. I'm just gonna tell you. Go watch that, and you'll learn a thing if you're willing to be a little esoteric about it. Anyway, there have been widespread reports of pressure being put on administration health officials to accelerate the development and approval of a vaccine that could halt or blunt the impact of a pandemic that has cost more than 185,000 lives in America. We know that number, by the way, is likely inaccurate. It's probably somewhere greater than 9,000 and under 185,000. We're saying 35,000, 37,000 is the number I came up with, split the difference. Or in other words, what the flu does. And wreaked havoc on the economy not seen since the Great Depression. Harris said she expected that medical experts would not be allowed to make decisions on a vaccine without interference from above. They'll be muzzled, they'll be suppressed, they will be sidelined, she told CNN. Because he's looking at an election coming up in less than 60 days and he's grasping to get whatever he can to pretend he has been a leader on this issue when he has not. Concerns over the potential politicization of the COVID treatment and vaccine began in the spring when Trump touted anti-malaria drug hydroxychloroquine despite weak evidence the drug was effective against the virus. So let me talk about that for a second. So those of you who didn't listen, look, it's Coronavirus Central, number one coronavirus podcast on the internet. Hydroxychloroquine was incredibly effective. It was especially effective when combined with azithromycin, that's an antibiotic, and zinc. And why does it do that? Because what happens is zinc basically plugs the door of the cell, but it has to be done early. If you go ahead and use a fire extinguisher on a raging 5-alarm fire, it's not going to work. And that's what they did with the tests. The tests were rigged to show it didn't work. Why? Hydroxychloroquine wasn't owned by Big Pharma. It was in the public domain, as happened to all drugs after 10 years of usage. And what was out there is, remember, all around the world, even in countries where this was very light, this virus is being used as a means for authoritarian control in countries both communist and capitalist alike. Why? Because we see a convergence happening worldwide, where we have a worldwide crisis that's leading to a worldwide solution. Why? Well, you tell me. What is it they want to create, and why is this so useful? Because when the ends don't match the means, you really have to figure out what the ends are doing, and that's what we have to look at. We have to ask these questions. Myself, I believe they want a new world order. I believe they want a global convergence that happens, and that part of that, the working of destroying the United States, is because we, being the ones most likely to resist that, are actually being set up for a fall. So all of these different pieces, the riots in the streets, the fights over the vaccines, the political warfare that's going to lead to civil war, all of these things are efforts to destroy the idea of sovereign individuals. Why? Because you want to have a global centralization. And other countries that are acting well are being allowed to do that, and we are being destroyed from within. Why do I say that? Because a whole bunch of money is going to every force of discord, where in a sane country it would be used to pull us together. So why do people with all the money and power want to destroy all the nature of the United States? Well, you need to be asking that question every single day. And you know, it's funny for me to say this, right? Because those of you who know me know that I've been an outspoken dissident and separatist for many years, and I have no love for the United States as presently constructed. But I will say this to you, as someone whose whole job is to understand and study deconstruction, this is a controlled demolition that's happening of the whole nation. And the fact that it's being done by those on top should have you be asking a lot of questions, okay? The Food and Drug Administration, the federal agency in charge of approving vaccines and treatments for public use, carried out an emergency use authorization to allow use of the drug without the testing and trials that are usually accompanied with a drug rollout. The EUA for hydroxychloroquine was revoked in June, with the FDA saying the drug is not proven effective against COVID and can have severe side effects. By the way, the side effect of hydroxychloroquine is that if you use it every day for 5 years, you might go blind. So for a treatment that lasts an average of 2 weeks, you're being told you can't have this because of blindness. If you actually know the facts of the situation, you start to realize how sketchy this whole thing is. In late August, Trump announced another EUA for convalescent plasma, a type of therapy where the blood plasma from a recovered COVID patient who has developed antibodies is given to a patient fighting the disease. While one study conducted on the therapy suggested the treatment could be helpful, public health experts, including Dr. Anthony Fauci, nation's top infectious disease expert, says there needs to be larger randomized trials in order to ensure the efficacy of the treatment. Earlier this week, the Centers for Disease Control asked states to expedite approval for vaccine distribution sites by the 1st of November. See how they're rushing this out for the election. Stephen Hahn, head of the FDA, indicated that he would be willing to authorize a vaccine before Phase 3 trials were complete, a controversial move that has been taken by China and Russia. Hahn insisted he would not expedite a vaccine to appease the president. So just so you know what Phase 3 trials are, that's where they try them on human beings. So they're not even trying this, just saying, here, take this, it's going to work. And trust us. Trust us. Dear Lord, my people perish for want of knowledge. Don't take this vaccine. Really, don't. I mean, if you can be mad at me, wait 6 months and then see, wait a year and then take it, okay? Moncef Slaoui, the co-chief of the White House initiative to release a vaccine, said it was possible but unlikely that a vaccine would be ready by the 1st of November. There is a very low chance that the trials are running as we speak could be completed by the end of October, he told NPR. For weeks, Trump has been claiming a vaccine is right on America's doorstep, an optimism that is not shared by public health experts. He told a cheering crowd at the Republican National Convention last week, we will have a safe and effective vaccine by the end of the year. And that's weird for Republicans. That's really weird. The Trump administration has dismissed accusations as claims of confidence in a vaccine in the next few months are a way to boost Trump for Election Day on the 3rd of November. I think it is a very irresponsible to how people are trying to politicize notions of delivering a vaccine to the American people, Alex Azar, the Health and Human Services Department Secretary, told CBS on Thursday. Trump himself has denied that any motivation to get a vaccine out around Election Day has anything to do with the election itself. I'm optimistic that it will be around that date. It wouldn't hurt, he said. I'm not doing it for the election. I want it fast because I want to save a lot of lives. Maybe that's true. Maybe it isn't. Who knows? But I want to go ahead and I want to talk to you about, I'm going to grab a piece from, it was a little further back. This is from May 11th. And it was written by Joseph Mercola at Mercola.com, okay, who covers these sorts of things. And this is also on Lou Rockwell, the well-known hazards of coronavirus vaccines. You need to know the history of what goes wrong with these before you rush into things as we go skip through trials. And know that if there's never been a successful vaccine created for a coronavirus, when they created ones for other strands like SARS and MERS, they ended up killing people. And that this is all assuming this is all above board. And oddly enough, it's weird how everything comes forward in time. We talk about these controversies. We talk about the deep state. You know who one of the biggest advocates against these things is? Robert F. Kennedy Jr., son of Robert Kennedy, the murdered Attorney General and brother of John F. Kennedy, the president who was killed, who went ahead and stood against certain groups, i.e. the bankers, that you need to know about. That it's funny that those same people, that family who's been tortured by the deep state, is actually the ones who are speaking strongest against this. Scions of the Democratic Party who've been exiled, and Republicans would never listen to them, but it's really interesting to hear some of what they've learned. Robert F. Kennedy Jr., son of Senator and Attorney General Robert F. Kennedy, and nephew of U.S. President John F. Kennedy, both of whom were tragically murdered, has continued in the footsteps of these famously courageous men by standing up for the truth. He co-founded Waterkeeper Alliance, the world's largest clean water advocacy group, and provides legal counsel for the National Resource Defense Council, which helped protect organic producers. He has also fought legal battles on behalf of the Informed Consent Action Network, founded by Dale Bigtree, and chairs the board of directors of the Children's Health Disease. Kennedy wrote a brilliant foreword to Judy Mikovits's book, Plague of Corruption, in which he quotes his father saying moral courage is one of the rarest species of bravery, rarer than the physical courage of soldiers in battle or great intelligence. His father believed moral courage was one of the most vital qualities required to change the world, Kennedy says. And it is actually true, because it's much harder to go up there and say something opposite to what people believe, because they will attack you mercilessly for it. He's right about that. Kennedy wrote a brilliant foreword to Judy Mikovits's book, Plague of Corruption, in which he quotes his father. Okay, we skipped that. While Kennedy was referring to her moral courage, the same can be said for Kennedy himself, whose career as an environmental attorney and activism is built on defending those who cannot defend themselves. This includes children who are being harmed by vaccines that have yet to be tested for safety, especially when given in combinations with other vaccines. In September 2018, Kennedy proved the U.S. Department of Health and Human Services violated its own mandate for safer childhood vaccines as stipulated in the Vaccine Injury Compensation Act. What happened to Trump's Vaccine Safety Commission? When President Trump was elected, he contacted Kennedy and asked him to run his Vaccine Safety Commission. Unfortunately, the Safety Commission never got off the ground. And this is interesting. This is something you see with Trump, by the way. Even if you're a right-wing person, I'm going to build a great, big, beautiful wall. Didn't do it. I'm going to lock her up. Didn't do it. I'm going to fight vaccines. Didn't do it. Why? Because what Trump is good at, he is an expert at playing the media to get us into fights where he never has to do anything. All he has to do is go ahead and serve as a weapon of mass distraction. So this Kennedy's talking here. I agreed to do it, but immediately after that, Pfizer wrote a $1 million check to his inauguration committee. He then appointed a Pfizer lobbyist, Alex Azar, to run the Health and Human Services Department, and he picked a Pfizer insider, Scott Gottlieb, to run the U.S. FDA. As soon as they got in there, they shut down the Vaccine Safety Commission and any other questioning of vaccines, Kennedy says. I think a lot of people were telling him you shouldn't be doing this, and Gates was one of them. But once he took the money from Pfizer and put in their guys, the commission was dead in the water. Kennedy goes on to share some of his insights and take on what Judy discusses in her book, the potential relationship between the flu vaccine and COVID, and his views on the COVID vaccines currently being fast-tracked. With regard to the COVID vaccine, he says, we're all waiting for a vaccine, and if they come up with a vaccine and they've actually done real safety testing on it, and the vaccine works, I would be happy to have it. But the problem is they're not safety testing it. People have tried for many years, for 3 decades, to create a coronavirus vaccine. The coronavirus can be super virulent, super deadly, and super transmissible, or it can be mild like a cold. The Chinese have been trying to develop a vaccine, and when you try to create a vaccine, what you do is accelerate evolution. All right? How to accelerate the evolution of a virus. As explained by Kennedy, the way they accelerate evolution is by taking coronavirus from the anus of a bat and replicate it in animal tissue such as pangolin kidney tissue. Next, the grown viruses are placed on feral monkey kidney cells followed by mouse brain tissue. Each time you transfer the virus to another animal tissue, you increase the risk of zoonotic animal virus contamination in addition to mutations. According to Kennedy, 6 years of evolution can be accomplished in a matter of days using this accelerated evolution process. Through this process, extremely viral forms of a virus can be rapidly created. Typically, milder forms are used to create a vaccine, as explained by Kennedy. And by the way, we know this is the sort of stuff that was happening. We know this is what they researched in Wuhan because there were papers about it, and we know that they ultimately got the techniques originally from the United States, University of North Carolina, Chapel Hill. Okay, you can go look at them. Ralph Barrick's the guy's name. Kennedy says, you can take a mild form and give the person that mild form and they don't really get sick. They develop the antibodies, and that's the theory behind vaccinations. But there are reasons they like to create these super viral forms. One is most of the labs where they do it, like Fort Detrick in the United States and the Wuhan lab in China, are not only vaccine labs, but they're also military labs. And remember, Trump's been saying the military is going to get this out there immediately. Why is there such a rush, right? So they want to mess around and look at these viruses that they may be able to weaponize. Not only that, the people who are creating vaccines like to create super viral forms. They give them to mice who have been genetically engineered to have a human immune system, essentially. Then they try to cure them. These experiments were going on in the United States until 2014. They were Dr. Fauci's projects. President Obama ordered that to stop because they had a lot of lab escape problems in 2014 from 3 different labs. Instead of stopping as he was ordered, Fauci moved these operations to the Wuhan lab in China and continued to do these experiments right up until the time the coronavirus pandemic occurred. In fact, infectious disease expert Ian Lipkin was doing these experiments over there when COVID exploded. And I'll tell you exactly what happened because it's very suspicious. Next bit, was SARS-2, that's COVID's virus, released to safeguard continued research. Kennedy continues telling the story of how the COVID-19 epidemic may have been generated by releasing the virus to ensure that dangerous coronavirus research would continue and receive fresh funding. When President Trump came in, Obama had an office in the White House for pandemic disease. For pandemic security, they were involved in funding coronavirus research projects in Wuhan through Fauci. Trump ended all funding for that office on September 20th, 2019, so that was the last paycheck any of those scientists got. On September 30th, 2019, a whole lot of scientists were laid off in Wuhan. October 1st is when the first case of COVID was reported. So it's suspicious because it looks like there's a possibility, and I'm speculating here, I want to make that clear, but there's a possibility someone who lost their job in that lab could have released the virus. Because immediately it created an instantaneous market for people with that particular skill set, which is how to study how to make a coronavirus vaccine. So you could go from unemployed to highly employed almost overnight if you released one of those microorganisms organisms they were creating in that lab. I don't know if that happened, but that's something that needs to be investigated. You see how sordid this whole game is? And look, I don't know what happened. I don't know if it was a deep state conspiracy, some pissed off person who created an opportunity, asymmetrical warfare between nations. I know it's not the story you're being told, and I don't know if we'll ever know the truth, but I think the truth is at this point, regardless of why COVID happened, too many people have seen the opportunity in this for this to be used anything other than to create global authoritarianism. But I want to give you a little history of this because you don't know anything unless you know the history. You have to know how things evolved and what people did. How many of you guys know that Fauci, if you go back in time, was actually involved in sort of restraining how quick AIDS vaccines came out, or AIDS treatments came out? There's a long history of things that you're not even permitted to cover, and the media never tells you any of this. They just say, trust us, we're good, and put big smiley faces on. Never trust the media. In fact, don't even trust me. Research, and if you think I'm wrong, look me up. I welcome the challenge because you know what? I'm a guy up in a cabin telling you how to live, and your life is in risk in things you can't even imagine at this point. Most journalists now act as pharmaceutical reps, the story continues. An even broader agenda appears to be the introduction of a far more authoritarian regime, along with the transfer of wealth from average people to the richest through a planned economic collapse. This was written in May before it happened, so just look, so it gives you a little credibility, right? Of course, that's speculation, Kennedy says, and stuff that if we were living in a true democracy where there was a free press that was actually permitted to ask those questions, or actually tried to, and speculate on that, then we would be doing an investigation of those questions. We have a right to know, and we all ought to know the answer. Unfortunately, journalists today are no longer journalists, they're pharmaceutical reps. You're a huge threat to them because you're not part of the pharmaceutical establishment. You're telling people the truth, which is that there are problems with the germ theory, and that the first line of defense we have against illness of all kinds, including infectious disease, is a really strong immune system, and that our immune system functions in an evolution-intended way, which is to fend off billions, hundreds of billions, infectious viruses every day. And keep in mind, Kennedy's been out there putting things further. There was this great story that's out there. It's apocryphal, but it's interesting, where he was going to go and do this whole expose on Fox News, and Roger Ailes killed it because he's like, we get 40% of our revenue from pharmaceutical companies. We're not going to go ahead and bite the hand that feeds us. And that's what happens. They never bite. Why are there never stories about the Federal Reserve? Well, because the Fed has a lot of money. Why are there never stories about Big Pharma? Because Big Pharma buys them. It's cheaper to buy someone's silence than it is to spread the truth. And then you just credit them. Say, oh, that's a conspiracy theory. Well, there's conspiracies in the world. What do you want me to tell you? It's the way of it, you know? All right, Kennedy goes on to summarize the history of coronavirus vaccine development, which began after 3 SARS epidemics had broken out, started in early 2002. And for those of you who don't know it, there's suggestion in the viral community, if you look at this, the people research this, that SARS itself was probably a failed effort at genetic engineering. I mean, the timing of it's perfect for it. The first one was a natural epidemic that moved from bats to human beings. The second 2 were lab-created organisms where everybody were experimenting with the coronavirus. That's not controversial. Everybody accepts that. So I will say, actually, there is a little bit of controversy in the fact that the first one may not have been as natural as it seems, but let's continue. The Chinese, the Americans, the Europeans all got together and said, we need to develop a vaccine against coronavirus. Around 2012, they had about 30 vaccines that looked promising. They took the 4 best of those and manufactured the vaccines. They then gave those vaccines to ferrets, which are the closest analogy when you're looking at lung infections in human beings. The ferrets had an extraordinarily good antibody response, and that is the metric by which FDA licenses vaccines. Vaccines, as you know, are never tested in the field, except they're doing it with COVID. Right? They never give 5,000 people the vaccine, 5,000 people a placebo vaccine, then tell them to go out and live life and watch what happens to those people. That never happens. The way that vaccines get licensed is that the FDA gives people a vaccine, or the industry gives them the vaccines, and they do a serological response or test to see, did you develop in your blood antibodies to target the virus? The ferrets developed very strong antibodies, so they thought, we hit the jackpot. All 4 of these vaccines worked like a charm. Then something terrible happened. Those ferrets were exposed to the wild virus and they all died. They developed inflammation in their organs, their lungs stopped functioning, and they died. Then those scientists remembered the same thing happened in the 1960s when they tried to develop an Rsv vaccine, which is an upper respiratory illness very similar to coronavirus. At that time, they did not test it on animals. They went right to human testing. They tested on, I think, about 35 children, and the same thing happened. The children developed a champion antibody response, robust, durable. It looked perfect, and then the children were exposed to the wild virus, and they all became sick. 2 of them died. They abandoned the vaccine, and it was a big embarrassment to the FDA and the National Institute of Health. Those scientists in 2012 remembered that, and they said, this is the same thing that happened back then. So they looked closer and realized there are 2 types of antibodies that were being produced by the coronavirus. There are neutralizing antibodies, which are the kind you want, which fight the disease, and then there are binding antibodies. The binding antibodies actually create a pathway for the disease in your body, and they trigger something called a paradoxical immune response or paradoxical immune enhancement, or some of you might know it as ADE, antibody-dependent enhancement, where what happens is the virus is set up in a way where it can connect to the antibodies, but the antibodies can't kill it. It basically creates, of the antibodies, a subway system to go through your body. Remember, these are the same people who are working for Global Solutions who have been telling you for years that there's too many people, climate change, unsustainability, food scarcity, and as you see the famine being engineered by the efforts to shut down agriculture every step of the way, and there's not enough people rushing to get vaccine, people at a panic, when a whole bunch of people start dying from this terrible disease that's horrible for humanity. Keep in mind, even when people get vaccinated and say, oh, it's a new strain, is it? Or is it a vaccine? These are things you need to be aware of, and these are things that could very easily happen, because remember what I told you about the elites. They don't like that there's too many people here because it's a liability for people to control. More people have died from states killing their own people than every war in history, by a factor of about 10 to 1. So who should you be afraid of? The people who are in charge over you. All right, where are we? So what means is that it looks good until you get the disease, and then it makes the disease much, much worse. Coronavirus vaccines can be very dangerous, and that's why even our enemies, people who hate you and me, Peter Hotez, Paul Ofted, Ian Lipkin, are all saying you've got to be really, really careful with this vaccine. And do you think the haste with which they're doing this is really, really careful? I don't. According to Kennedy, the same thing happened in 2014 with the dengue vaccine, Denvax, which Fauci owns the patent on. So he's been involved with stuff like this before. They knew from the clinical trials there was a problem with the paradoxical immune response, Kennedy says, but they gave it to several 100,000 Filipino kids anyway. They got a great immune response from the vaccine, but those exposed to wild dengue got horribly sick, and 600 of the children died. Today, the Philippine government is prosecuting criminally a bunch of the people locally who were involved in that decision, Kennedy says. And those are the people who got, for those who don't know dengue fever, when you get infected by a different strain, it can be utterly deadly. And this is just showing you and I'm not saying that people don't have weird things happen, okay? So I want to be very clear what I'm saying, but these are a problem because you end up with different strains that go forward of a similar antibody. You're going to get the carrier antibody, not the neutralizing antibody, and that's what you really need to be afraid of. And what are these people doing to say, we're going to hit you with it twice in 28 days? Great, right? Coronavirus mutates rapidly. Another problem with coronavirus vaccines is that coronaviruses mutate very rapidly. Kennedy cites a Chinese study, Patient-Derived Mutations Impact Pathogenicity of SARS-2, which also was reported in the New York Post on April 21st, 2020, in which they looked at coronavirus strains found in hundreds of patients. They identified more than 30 different strains, 19 of which had previously not been seen. According to the authors, current genomic survey data suggests that single nucleotide variants are abundant. Here we report functional characterizations of 11 patient-derived viral isolates, all of which have at least one mutation. Importantly, these viral isolates show significant variations in cytopathic effects and viral load up to 270-fold differences when infected Vero E6 cells. We observed intrapersonal variation in 6 different mutations in the spike glycoprotein, S protein, including 2 different SNVs that led to the same missense mutation. Therefore, we provide direct evidence that SARS-2 has acquired mutations capable of substantially changing its pathogenicity. So what are they saying? They're saying that the nature of how it connects is changing in such a way where it will now be able to act on different areas. And we saw this in how the disease expanded from different variations to attacking different areas. What looked like pneumonia at first looks now like a blood disease, and now it looks like something else. And here's one of the interesting things. This disease has seemed to have a very quick ability to change, and it has shown different ways to go forward. So a vaccine that has a static version of antibodies is going to be unable to stop it. In fact, what it will serve as an ongoing hindrance to go ahead and stop this, it will accelerate it because the disease will change. And even if theoretically it becomes less virulent, the problem is you're allowing it to have greater efficacy in terms of the damage it can do. Why are you seeing the RNA-based vaccine that Moderna represents? Well, they figured they need to have something that produces antibodies that are only neutralizing and not carrying. But one of two things must be true. Either it will continue producing those, in which case then it's begging for this sort of immune-dependent enhancement to happen, or that it has to have the ability to change what it's doing depending on what's happening in your system, in which case then you have something in your body that's being put in there that's literally changing how your body fights all the time, nanotech inside of you. And either if that doesn't happen organically, and I'm not really sure how it would because you wouldn't be able to do that, it would have to be able to be controlled remotely. So you want to know why people are scared to death of what this vaccine could do? Theoretically, the only way it could actually do what it claims to do without killing you is if A, it knew exactly what strains you were dealing with in the environment, and B, it could modulate to that, and who would modulate it, because the body won't know how to do that other than building natural antibodies, unless it's some sort of ability to put this together. And so as you get into the ethics of the biotech involved here, you start to realize something must be terribly wrong, and that this is being created as a means to a terrible end. All right, that only is going to provide limited support. This is not something you can vaccinate against, at least not the way it's ever been done historically. And if we're doing something that is totally ahistorical with how we're treating our bodies, then that's the story you should be hearing that no one is telling you. And that's what we're hunting for on this show. As noted by Kennedy, the question is, if you vaccinate against one of those strains, will it protect against the rest? Or will it make the coronavirus act more like the influenza virus, where the vaccine will only give you a narrow band of immune response and or might actually enhance injury from other strains? The World Health Organization and British medical services are now saying there's no evidence that even getting an infection from the coronavirus equips you with antibodies that will protect you in the future. They've got a list of, they're seeing a lot of reinfection from people who got COVID, got better, and then got sick again. If that's true, then it's unlikely that any vaccine will work, because natural infection always gives you a wider band of immune response than a vaccine. So they're saying here, historically, that if people who get this again, then a vaccine really isn't going to work. And yet they've been pushing harder and harder and harder about this. And so if you go through the rest of the article, I'm not going to read every one of these here that's in here, because it's kind of a longish article. It goes into a lot more detail about this. But what it would say, if you read the rest of it, and I'll put it in there, is that they'll say that, different testing could go ahead and have these problems happen, or that flu vaccine, I'll just read the subheadings. Flu vaccination increased the risk of coronavirus infection. That flu vaccination could trigger a positive test, right? So you have to get the vaccine. And they talk about different treatments that could be considered that have been looked at since then, about ways you could use plasma treatments and interferons to go forward, that there are other methods out there, but these are things that aren't being considered. Why? Because we're rushing into the vaccine. And so suggestions are made about other ways you can make a safe vaccine, but those aren't the paths we're taking. And rather than digging you deep into health here, on Free Atlantic Radio, what I want to present to you is the broad stroke of the argument that you need to understand, which is that these viruses, are very dangerous. They can't be vaccinated against, and by vaccinating against them, you make them worse. And why and when have we ever seen the big pharmacy industry go ahead and create a problem that needs constant reinforcement rather than a solution? Well, think how much money is there to be made on that. Think how much control is there to be had of something that can never be fixed but always must be fought. It is the war we must fight for the goodness of humanity. And Lord knows I believed it. I was one of the first adherents of it. But I'm telling you, this is a crock. They're lying to you about what you're being made to fight, and they're lying to you based on their own evidence, and the only thing they're counting on is for you to listen to authority figures rather than understand on your own. So you do your own research. Don't be lazy, be diligent, and don't be first to volunteer for things going forward, because it might be the last mistake you ever make if you get it wrong, in terms of both sickness and danger to your body, as well as the things that you're putting in that you don't even know about. And believe me, they're not going to tell you. That's proprietary. You're not allowed to do it. Just take your thing. And if you're going to stand against this, I should tell you also, you should be prepared that it's going to be a lonely road, because what's going to happen is you are going to be exiled from society in a lot of ways by not having the choice to go ahead and do this. By not being permitted to do certain things. You will be excised from jobs, you will be excised from healthcare, and eventually people will hate you for standing against this. And why does the government like that? Because government hates dissidents. They hate people who like to think they want to have sheep that they can herd off the cliff. But if you want to be a good sheep, you need to seek out the good shepherd. And that's why every show, what I show you is I build for you a logical explanation for why you want to approach a certain way. And it's funny how, at least in my way of thinking, which you may or may not agree with, is it shows how Christ kind of suggested these sort of things you need to be really aware of. So let me go ahead, and I'm going to share to you a harsh word at the end of this, but it's a word you need to hear, and I will share it to you because you really need to think about what's important to you. It's from the book of Revelation, which you're not supposed to quote, but I'm going to do so. Revelation 13, lines 16 through 18. Also it causes all, both small and great, both rich and poor, free and slave, to be marked on the right hand or the forehead, so that no one can buy or sell unless he has the mark. That is the name of the beast or the number of its name. This calls for wisdom. Let the one who has understanding calculate the number of the beast, for it is the number of a man, and his number is 666. So a lot of Christians will go out there and they will tell you that the mark of the beast, in fact, the Bible says, if you look at it, there are two things that you cannot survive. Your soul cannot survive these two sins: to blaspheme the Holy Spirit, which means to go ahead and to say that what happens is to blame the Lord for things that are the acts of man, that ultimately to fail to recognize the ultimate goodness of God, which is the idolatry against which Jesus speaks. But the other is the mark of the beast, and why the mark of the beast should be so hostile is an interesting question. And so Christian scholars have thought long and hard about this, and the conclusion that many have drawn is that there is something about that changes the nature of what man is to something where he is no longer man anymore and he can't reach salvation. So as we go forward into this age of transhumanism and different beliefs, I would caution you to think about what your humanity means to you and do not trade it away so freely for something that would change things. Moderna has promised a vaccine that will change your DNA and change your RNA. Is that something you are okay with? Do not let it be something you walk into idly, and do not let it be something that will be forced into you, because what you may become may be beyond your control. I've tried to present the argument for why you need to realize that this is not what it is before you agree to it. I wish, as well as everyone, that no one would get sick from anything and that no one would have these problems. Nonetheless, the fact that we're being given a novel vaccine to something that has been a problem that has not been able to be solved for years, and that there's a line of bodies behind this, that there has been corrupt research behind this for many decades, and that ultimately the creation of a new solution was made by a man-made problem that was released by people who've been corrupt and cynical all along, should give each and every one of you pause before you rush forward, not because you don't care about your health, but because you do. And you don't have to be a Christian to believe that, but it helps when you can see the deeper insight of this. And I share the word with you because I want you to see the world in a deeper way. One thing I wrote on Twitter the other day that I think is a really good message is that we assume that objective reality is the highest mode of being, and that our spiritual preferences are aesthetic things we consider. But allow me to share to you, as in so many things with what we see in the media, this is inverted. The truth is, our society is the function of spiritual impulses that we embrace in each and every one of our hearts, and that as we become better people, we end up with a better or worse society. So if we become in love with the idea of our own good and when we impose it on people, that is the means by which we will be manipulated, and that is the sin that leads unto death, because ultimately we assume because our enemies oppose something that we should support something, and that we find the same judgment exacted on ourselves. And this is why man's virtue never ends up working. Complex theology, I know. They're not allowed to teach Luther anymore. They just teach Jesus is your friend. There's a lot more in the Bible than that. You should get wise in the Word. But regardless of whether or not you're theologically minded or not, use the same sort of logic to vigorously assess the dangers and opportunities of this virus, of this vaccine, and decide what you're going to do for your family. As for me and mine, we will serve the Lord. God bless each and every one of you. I will be back to go ahead and speak more on topics for Friday. Then, as I said, I'm going to be down for at least a week, perhaps two. I just don't know how long it's going to take me to write In God We Must. But I do have some good news for you. Kanaz Filan, who ran our sister show at Free Atlantic Voices, will be providing some material for you next week. So we will definitely have material for you to listen to that I will host gladly as part of Free Atlantic Radio. So we will continue forward. So yours truly can go deeper into some of these mysteries. And if things get really funny, I reserve the right to come back at any time to say whatever I want. And I will be back to each of you because I miss you very much. And with much love and support for each of you, I just want you to go ahead and be safe, but be smart. Don't believe things just because someone tells you, whether it be me or anyone else. We're all liars and sinners out here, but some of us are at least trying to look for redemption. That's a good word of repentance to end with. God bless. Have a great day.